So the topic today is communicating across the species divide between human health and animal health. So as a human health physician, I just want to give a little bit of perspective of how this looks coming from the human health side. In medical school, residency training, fellowship training, I was basically taught nothing about animal health, and there was no time where I was told that for any particular clinical situation or even a public health situation, I should go and talk to a veterinarian. So that's sort of the one starting point, is that there's just, in terms of communication, I never saw examples of it, and I was never taught to communicate, or that there was any value in communicating between human health and animal health. And so I think I wanted to just say the sort of the perspective that I think physicians get from this kind of background about animal health and where it's been and then where I think it really is going and could go. So where I think it starts, from training and never hearing about animal health or being told that there's anything important about what veterinarians do or animal health in general, is that I think physicians get sort of an us versus them approach to animal health, which is that animals carry all these scary diseases, animals can bite us, animals can give us allergies. It's just important to keep animals healthy somewhere, but sort of keep them far away from people, and do whatever you got to do to keep the animals healthy, keep the food safe, but just sort of keep us versus them sort of separate. And that doesn't involve a lot of communication or engagement between human health and animal health. The other thing that we think about with animals in human health is that animals are useful for research. They're animal models that help us develop new drugs and develop a better understanding of diseases. So Yale, where I work right now, does not have a veterinary school, but we do have 70,000 animals. They just all tend to be small little white things with 4 legs and in cages somewhere. So there's a lot of animals there, but we actually never see them, but they play a large role in the medical school in many ways. So that's sort of that two approaches to animal health that we get. And where I think it's changing is that instead of this us versus them, I think there's a need for what I call a shared risk idea, that it's not just that animals could make us sick, it's that as so many things are happening in this world, the number of animals is increasing almost as fast as the world's human population. In order to feed the human population, diseases now are going back and forth between humans and animals, and it's not just people getting sick, it's animals getting sick too. And the changes in the environment, in the ecosystem, are affecting animal health as well as human health. And unless we work together with animal health in that, we're going to miss all the signals coming about what the next new threat is from the environment, whether it's influenza, whether it's a toxic hazard. Many times the animals can be, as we're talking about, sentinels for these environmental health threats. They can be the canary in the coal mine, but if we're not looking for the problem with the canary, we're going to miss it for human health. So I think we really need to move from the us versus them to a shared risk. The other thing that's coming in clinical care, I think, is the understanding of the human-animal bond. Most households in this country have pets as part of the household, and people are really willing to put medical resources into keeping these pets healthy. Many times they take better care of the pets than they take of themselves. They take care of themselves, do more prevention for the pets than for themselves. And I think most doctors are totally unaware of the amount of medical care these animals are getting. I didn't realize that in Connecticut there are 2 linear accelerators for cancer treatment in animals, and all the things that go with that, and that's just not that atypical. And so it's a whole parallel universe that we just haven't learned to even communicate with, and I think we can find out a lot from there. So the human-animal bond is important. When it comes to the use of animals in research, what I think is really interesting is that many other animals besides mice can tell us things about human health, and actually dogs spontaneously get cancer and are often a better model for cancer than mice are. And cats are a much better model for asthma, which is often environmentally induced as well. And we can learn so much from the care that animals are receiving in terms of what works to treat them and why they're getting sick, that could really help us with human health. And so I think there's a lot of overlap between the kind of clinical trials that can now be done in animals and the understanding of what makes a particular breed of animal spontaneously develop tumors, and is there something in the environment that can do it. So there's all this clinical information that we potentially can access in human health that we just have not been accessing in the past, but I think that the future is to really share this information back and forth and have sometimes a drug that's developed purely for animals turn out to be useful for people as well, and treatments like that. What it essentially ends up requiring is communication between these spheres to have a whole new relationship between these